What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Wonderful. Thanks, everybody, for being on again. And please tell all your friends, associates, anybody that you think can benefit from this. I know most people can benefit from this podcast because today we are talking about hair loss, and that goes for both men and women. And I don't know if you know this, Brian, but 50% of men experience some sort of hair loss by the time they are 50 years of age. Many a lot sooner than that. And 40% of women are affected, by hair loss, at least by the age of 70.
I certainly know mine is receding.
Yes.
I certainly know. I look in the mirror and feel a little, oh no.
Yeah. Mine is too. I notice it all the time that my forehead is getting bigger. But there's a lot of things that people don't know that can really help slow that process down or even reverse it, that are both pharmaceutical interventions and also natural more interventions. So that's what I want to talk about today for the most part.
Yeah, let's get into it so we can save my hairline. Well, I still got it.
Yeah. I mean, and we know that it's a big deal, right? This is a multi-billion-dollar business. I mean, there's a lot of psychological harm that goes with that. There's cultural, societal pressures about hair loss. Although I think my younger brother wears it well. He has no hair at all. That's probably why I'm growing my hair so long, so I can keep it as long as I can. But it's kind of in vogue being bald, but it certainly isn't for women and a lot of men. There's also a lot of psychological stress and angst about it.
Yeah, absolutely.
As we get older. But the average person's scalp contains about 200,000, 500,000 hair follicles. And these follicles undergo repeated cycles of 3 phases. And they're called anagen, which is the phase, and then catagen, which is the regression phase. This is where the follicle shrinks and detaches from its hair. And then the telogen, the resting phase. So these are the 3 cycles. And I just bring that up because we'll talk about those phases a little bit. On a healthy scalp, we're talking about 90 to 95% of the hair follicles are in this growth phase or the anagen phase at any given time. And it's normal for the hair on a daily basis to lose a scalp to lose anywhere between 50 and 150 hairs per day. And I actually have patients who have counted that. When they say they're losing their hair, they'll give me numbers. They'll actually count their hair in the shower drain. And if we're getting way above that on a regular basis and it's ongoing, then we need to look a little bit further into it.
Mm-hmm. So that 51 to 150 is something we're gonna replace generally. That's a rate we're gonna keep steady on.
Okay. Yes, you lose your hair, but you're also replacing at the same time, right? So, what it's called in medical terminology, like the losing of hair, is called androgenic alopecia. This is for both men and women, both genders. It's just called pattern hair loss. And some people are more genetically susceptible to it than others. And one of the ways that they treat it is by using drugs. Like I know you've probably heard of like Rogaine and Propecia.
Right,
stuff like that. Anyway, they work by 2 different mechanisms, but we'll talk about them a little bit different. But one of the main mechanisms is we know there's some relation to losing your hair, especially with men, and testosterone getting converted into dihydrotestosterone or DHT. And Propecia is one of those drugs that helps inhibit that. So that's one of the ways it works.
So we do not want this increase in DHT.
We do not.
Hair sake.
Yes, that's that's basically right. And the hair loss is a little bit different in men and women. So in men, it's primarily like, you get the receding hairline and you start losing it at the vertex or the crown. And then you also, you kind of get what's called the Hippocratic wreath, as they'd say, where you get the hair on the sides here that goes around, but you like bald on top and, like bald in this area. That's like the classic male pattern hair loss thing. Whereas women, it tends to be more diffuse and all over.
Okay.
And they just get, thinning of the hair. So it's kind of different. There are different types of hair loss. That's the most common thing. There's another one called alopecia areata. And that's basically an autoimmune condition in which the immune system attacks the hair follicles. And this can affect, of course, both genders. It can affect children. It's a relatively common form of hair loss. About 2% of people at some point have this during their lives. The telltale signs of this are like where you see like when it's bad, like kind of balding spots all over. And sometimes it can just be, it can be complete. And that's indicative of autoimmune condition. There are other causes, like medication certainly can cause it, trauma, stress. I remember back in my early days of personal training and back in our fat loss days where we would train people, and we had a number of people going through extreme dieting. Extreme dieting is if you want to lose your hair quick, go on an extreme diet and stick on it. It's almost like the
anorexia as well.
Yeah. Oh yeah.
Obviously much more severe, but
right. Same thing. And it's like the body is basically, trying to keep you healthy and alive as much as it can. So it's like, well, we got to pull from the nutrients we give to your hair. So we're not going to need that anymore. It's kind of that type of thing. You're very catabolic and you're trying to save the most vital things to keep you alive and healthy. So yeah, those things like extreme dieting, stress, medications are things to look at when you have hair loss. There are different types of ways to, medical terminology for losing hair. One is called telogen effluvium. Effluvium means like kind of a flow, a loss of hair. It's basically where, and this is where the hair transitions from a resting phase and then it sheds its hair instead of going right into a growth phase. It's triggered a lot by psychological stress and physical trauma and stuff. Women tend to have this more than men. Anagen, we talked about that as being like kind of the growth phase. This is a condition in which the shafts of hair are weakened and break during the growth phase. It's very common with like radiation therapy. And then there's like the scarring alopecias, and this is hair loss that is usually due to underlying conditions and application of chemicals. And you can see this sometimes. This is an interesting story. I had a friend when I was in medical school who was actually a hairdresser and said, Keoni, let me do a treatment on your hair because my hair is naturally curly and it's basically a straightening treatment. Well, this treatment, I don't know what they put in my scalp, but just burned your scalp. You had to rinse it off like you wouldn't believe, but it'd straighten your hair. Anyway, so my hair was completely straight.
You just look like you're playing the bass in a metal band.
Yeah, pretty much that, or look like one of the elves on Lord of the Rings. I mean, it was completely straight after I did it, but it was a painful experience for me. But anyway, I went to class one day, and this this girl with very curly hair goes, "Oh my goodness, you had curl in your hair. I always wanted to get my hair straightened. Tell me about it." I said, "Well, I went to a friend of mine to do this." Well, anyway, she went to him and got done, and it just completely ruined her.
Oh shoot.
I mean, I felt so bad for her. Needless to say, she was no friend of mine after that. But anyway, it came back. Usually those are temporary things.
And so those are just names. That was a topical, Keoni?
That was like a topical straightening solution. And I don't know what some hairdressers do. I mean, I think hairdressers are very aware that they can ruin somebody's hair if they do too much of whatever they're doing.
Yeah,
but
absolutely.
Some of these are harsh. They're harsh chemicals you're putting on your scalp. And anytime you're doing that, it's going to affect your hair growth.
Yeah, and we talk about your kind of topical rule of just if you're going to put it on your skin, you should be able to consume it.
Well, no, absolutely. You're right. And we will talk about some topicals that are much easier on your hair and can help with hair growth in just a second. There are also many medical conditions associated with hair loss, cardiovascular disease being one of them. The thought being here that with cardiovascular disease, the capillary beds are kind of like clogged up, so to speak. You don't get good blood flow to your scalp and things like that. You can lose hair, but it is associated with hair loss. Metabolic syndrome goes hand in hand with cardiovascular disease and diabetes. Also prostate, any type of prostate condition can also affect that. And there are thyroid abnormalities, hypo and hyper, immune thyroiditis, Hashimoto's. You see a lot of hair loss there. Of course, we also know that there's a hereditary component to it too. So my younger brother basically started losing his hair at a very young age. He's 40, 47. I'm 50 right now. He's completely bald for the most part. Of course, he shaves his hair, but he's completely bald.
Just grab him and throw him under the bus, Keoni.
Yeah, that's right. But there's definitely a hereditary component, but there's this myth out there that it kind of follows the mother's side of the family. And yeah, my mom's father was completely bald, and but that's not exactly true. I mean, I see that it could follow either side of the family.
And so as far as we see in the research and what you've seen, that really is just kind of wives' tale.
Yeah, it can follow any. I mean, there's definitely a genetic component to it, but it doesn't follow the maternal side of the family as opposed to the paternal. I mean, it's really a mix of both. Okay. And there's a lot of genes that play a role too. So it's hard to flesh out what's really going on there. And we will soon, I'm sure. Mm-hmm. We also know there's hormonal causes too, right? Hair loss is much more common during times of hormonal change. So women may experience hair loss in pregnancy. They may experience it during childbirth. Certainly menopause I consider it one of the telltale signs of going through menopause, being postmenopausal. The hair gets thinner. It's not as thick. You tend to lose more hair. As we said at the beginning, as women age, their hair will get more and more diffuse. PCOS, we talked about that on a podcast. That's certainly one. It's really interesting to know that PCOS is kind of like an androgenic type. The androgens are part of the problem in PCOS and can cause that. So we were talking about testosterone and DHT, which are androgens, and then there are also some infections, like sometimes fungal. We call it tinea capitis. Can certainly cause that. That's looking at the scalp. It's pretty easily to diagnose, but there's other things like psoriasis. You can get psoriasis on your scalp, which would cause hair loss, seborrhea, and there's also contact dermatitis. Liver or kidney failure, any type of malabsorption syndrome, especially that's related to the bowel, can also cause that. Chronic infections certainly can. HIV is one of them, but long-term chronic infections, heavy metal poisoning. And then even anemia, iron deficiency anemia certainly can do it too. There's actually a condition out there called trichotillomania, which is more of a psychological disorder where the person's constantly pulling their hair out. I've had a number of patients over the air. It's just like this psychological disorder where they're constantly pulling their hair out. And that's a cause. I actually know of a person who completely made themselves bald from completely pulling their hair out from this nervous psychological disorder. That is very treatable too. It also requires some psychological evaluation and help there, but also there are some natural supplements which we can go over that can certainly help with that. Yeah. There are plenty of drug causes to this too. So when I evaluate hair loss, I'm also looking at certain drugs. I want to make sure that the drugs they're on are not also contributing to the issue. All right. And some of these are anticoagulant drugs, beta blockers, oral contraceptives, anti-seizure medications, any medications that mess with the thyroid, like anti-thyroid medications, amphetamines, mood stabilizers, antidepressants. Feels like I just covered every major
commercial
drug group there is. Yeah. Yeah. You know, nutritional causes, we already talked about iron, but crash diets are a big one, which we talked about. Anything where the mineral status is lost or vitamin status is lost, this gives you a hint of what I'm going to talk about in just a few minutes here. I mean, iron deficiency, zinc deficiency, biotin deficiency, vitamin D deficiencies, all are related to hair loss. And most people are subclinically deficient, at least in zinc and definitely in vitamin D. So these are things that can help. Other contributing factors, and I know this all too well from myself, is I pull my hair back a lot. You pull it too tight, you're pulling your hair out. If you put too much stress on the hair shaft, your hair is going to fall out much easier. So people have really tight hairstyles or ponytails or anything like that, tight braids, well, it will also cause hair loss. Anytime you twist your hair or anything like that, it'll cause it to break. Or comb your hair too hard, you're actually going to pull it out. Any harsh treatments, home treatments that you may do, right? We talked about chemical treatments with like hairdressers stuff, but hot rollers, curling irons, hot oil treatments, permanents, all these things can contribute. So I will go through, when people are complaining about that, when they come to my clinic, I'll go through these things and at least, figure out if any of these things are contributing to it.
Yeah, start unlayering that onion.
Yeah, right. And then I'll go into just talking about, okay, well, what are the conventional treatments that are out there that have some good research that show that they work? All right. And one of them, which I'm sure you've heard, is Rogaine. It's minoxidil, and in over-the-counter, it's a topical treatment. And then the other main one is Propecia, Dutasteride, and that's an oral prescription med. Also, both men and women can use, primarily used for men. Minoxidil works by a mechanism that just basically is not fully understood, but you can think about it as improving blood flow to the follicles. All right, but we're not exactly sure. I mean, there's a kind of a mechanism of action that we kind of know of, but basically, without getting into details of that, increases blood flow to the follicle. It seems to also help nitric oxide increase around the follicle, which increases blood flow to it. And it seems to help just thicken hair. You have to use it for a while. And then the other one, Propecia or finasteride, that's the main one that's used. And that just, we've already kind of talked about that. And that's just a 5-alpha reductase inhibitor. And basically what it does is it inhibits the conversion from testosterone to dihydrotestosterone. And when you do that, it seems to reduce the amount of hair loss and can even cause more hair to grow in the places where you actually lost the hair. The problem with these meds, and as you can guess, is there's lots of side effects. And so for Propecia, impotence is a crashed libido, trouble having an orgasm, abnormal ejaculation, swelling of your hands and feet.
Ooh, I was really hoping weakness. Bigger wiener. You went the opposite route.
Now, unfortunately, you're going the opposite. Maybe bigger, but certainly not working as well. And then the with minoxidil, you can get burn of the scalp. You get facial hair growth, which for men it may not be that big of a deal, but for women it certainly can be.
Sure.
And then even some of these, even though they're being used to promote hair growth, like minoxidil, one of the side effects is increased hair loss, inflammation, swelling of the face. So these things are not ideal, but they can help, especially if you're not one of these people that are getting these side effects. But I always just say, if and when you can, you want to try to avoid these things if you can, or at least try the natural stuff first.
Yeah, that was kind of my follow-up question, is at what point would you recommend someone turn to something like this after they've exhausted all their natural options?
I would, yeah, that's where I would go. But typically it goes the other way, right? It's like they try this first,
you see the commercial,
and then they come back. There's another drug out there that works very different to finasteride or Propecia, and that's Dutasteride. And this one actually seems to work a little bit better than Propecia, because it's more of a complete 5-alpha reductase inhibitor than Propecia, even though the studies say at the end of the day they're about the same. But it seems to be a little bit better, and I'm pretty sure that's going to be one that's used more regularly, or on hand more often. Some of the other treatments that we know of, let's just say that you've tried, a lot of people will try those conventional treatments and, they don't work as well. And so they will go straight to like surgical hair restoration. So these are the main things. You're actually doing like hair transplants. You're doing stuff like, there's a number of types of transplants where they actually will take hair from the back of your neck and transplant it to the front, either take a strip or take the follicles, certain follicles, and put it there. I think they call it like strip surgery or follicular unit extraction. Those things certainly can help. I've known of people who have done, where they're going bald and they'll completely, since being bald is kind of the in thing, but they also want to show that they still have hair growth, where they'll actually tattoo like the hair follicles all over. So it looks like they just shaved their head, but actually it's a tattoo type thing. That's permanent. Yeah. And then, we talked about on a previous podcast, we talked about platelet rich plasma, PRP, right? We're talking about that with knee issues and joint issues. Well, as stated in that, I forget, that was 2 weeks ago, I think, that podcast that we posted. I forget the number.
174, regenerative medicine.
Yeah, 173. Yeah, there you go. That's right. Anyway, as Dr. Locke was saying, these platelet rich have a lot of growth factors in there. You inject them in the scalp, they can help. And then also stem cells will do the same thing. A lot of growth factors there. Those things can also help. The platelets from the blood, and you have to process them. The stem cells, you have to get those. So there's a lot to that. I know in people getting radiation therapy or chemotherapy to the scalp. A lot of times, part of the treatment they'll actually use to help with the side effects are these scalp cooling caps that you can put on your head. And basically, it's basically a cold cap that basically reduces the negative side effect of hair loss, and you're just cooling the scalp. So, the hair follicles aren't so stressed from either the inflammation of the treatment or the heat of the treatment, so to speak.
Mm-hmm.
So those are some things that are real and have some science behind them. There are some other things that are in use now. When we're talking about keeping testosterone from converting to dihydrotestosterone, you also think about other hormones, and there's some indication that topical estrogens may help, especially with women. We know that estrogen can help hair, especially in women, postmenopausal women. So this is one of those things that I will tell people, which is a easy thing to do and can have lots of benefit, especially if you're using bioidentical hormones, to use it. It's used more in Europe, but I think there's one study, a trial of 53 women with this female pattern hair loss, applied a 0.025% estradiol solution to her scalps daily for 8 months, and it led to improvement in hair density, and of course it was very well tolerated compared to some of the other things we talked about. Another topical treatment that you can try is vitamin A, and also it has a type of vitamin A called tretinoin, or all-trans retinoic acid. It's a form of vitamin A called retin A, and there's some studies where you combine that with minoxidil, and it increases the efficacy of both. They potentiate each other, and it promotes hair regrowth and also helps with hair thickness. Again, it's a top that seems to be well tolerated. Mm. So that's kind of like, I know I went through that kind of fast, but let's go into some of the natural stuff, because I find that these things are going to be the most well tolerated, and these things you can do, and it doesn't really require much with,
low risk.
It's low risk, and you don't have to, try this first before you spend a ton of money on something else.
Right. Have you seen success with those hair transplants, Keoni?
Yeah, actually, they seem to be, for a lot of people, at least some of my patients, they really, are, happy they did it and like it. I think they do work. I mean, they, for most people, they seem to be a good thing to do. They are, but it's quite a bit of money, and why not try the other things first before you go there?
Joe Rogan has a joke about it, because he had a hair transplant, and I guess it didn't work for him.
Yeah.
And
go ahead.
He's like, that's moving a bunch of healthy people to a really sick neighborhood and just expect them to be well on top of your head.
That's a great analogy, actually. I mean, it is a great analogy, but for some people it does actually work. I actually had a relative of mine who actually tried the stem cell thing and didn't get any benefit from it at all. And it was quite a bit of money. Yeah. Again, a lot of this you're paying out of pocket.
Yeah. Yeah. Blue Cross Blue Shield is not, or any insurance company, just so we don't get sued, isn't
right.
Is not
right
putting the bill for that.
Yeah, exactly. So the natural treatments, I'm going to go through a lot of things that I use in my clinic, and some things that people can think about. And then I'll talk about some Chinese herbs that also work pretty well for a lot of issues, especially when it's not, how should I say, when you're just getting like the hair loss here or there. It's not where you're,
it'd be good for me to start now.
Right, where you're going completely bald or anything like that. Yeah, the earlier you start, the better. So the first one, we always hear about B vitamins. The main vitamin that people know of for hair and nails and stuff like that is biotin, or vitamin B7. And there are certain genetic mutations or SNPs that can cause some hair loss in people, and some people have to just supplement with it. And there's a study of 38% women who, this is all self-reported, so these aren't like gold standard studies, but there's quite a bit of studies that at least support taking biotin to help with hair. And, in this one study, it was self-reported, but people taking biotin reported less hair loss. You see it in animal studies, certainly helping. And, biotin supplementation is not going to hurt. And most of the time it's part of a good multi. Another B vitamin that also has been shown to help is vitamin B6. 47 with diffuse alopecia, 200 milligrams a day of vitamin B5 with injection B6 for 20 to 30 days showed that hair condition improved, reduced hair loss, so on and so on. And then another study showed vitamin B6 in combination with, this is interesting to me, an amino acid called L-cysteine prevented hair loss, especially in people who are under chemotherapy, where losing your hair is kind of a common occurrence with chemotherapy. And there's one supplement that can really help with that, and that's NAC, which we'll talk about in just a minute, which is N-acetylcysteine. Vitamin D. Most people are subclinically deficient with that. Done a number of podcasts, talked about it a lot. Most people need to supplement, certainly don't have optimal levels, can help greatly with hair if you get optimal. A 12-week trial, 48 patients with mild to moderate alopecia areata, and this is the autoimmune component of hair loss, right? So we know vitamin D actually can help with any type of autoimmune condition. They were treated with a topical solution of vitamin D, a type of vitamin D. And at the end of the trial, more than 62% of participants had a 75% or better hair regrowth, and 25% of participants had 100% hair regrowth. I mean, that's really great for a non-invasive treatment.
Yeah.
I like stuff like that people can find. It's easily accessible. It doesn't have a whole lot of issue with getting it. No negative side effects, or very little, that are going to be documented. You mentioned,
these are very common in a good multivitamin.
Right. So, and that's one of the things that since you already brought it up, is why not, just another reason to take a good high potency multivitamin that's really bioavailable, because a lot of that is going to have a lot of these components in it that we've already talked about. One thing a multivitamin may not have, but it also comes in supplemental form, is saw palmetto, and that's an herb. It's popularly used. I use it quite a bit for prostate enlargement, and also in like the male pattern type baldness. And it kind of works, kind of like, it has some mechanism of action like Propecia does. So it's part of the mechanism of action is it reduces that conversion from testosterone to DHT. And then there's other components to it that also have some benefit, like beta sitosterol. And so it's one of those things that, there aren't great studies on it, but there's studies that are very compelling, and it's not going to hurt to do it. I use it quite a bit. And the other thing is using saw palmetto in conjunction with something like Propecia. I think there was a trial that showed where they were doing both. They'll potentiate each other and inhibit the hair loss. Essential fatty acids is another one. I don't think if you take essential fatty acids, I don't think you're going to see a wow factor. Like you take it one day and you're like, wow, I have a full head of hair. But over time, it should help. Mm-hmm. So again, it's just like, why not? If it's certainly not going to help. There's some compelling animal studies on this. There's also compelling human studies where they're using things like DHA, essential fatty acids, in conjunction with Taxol, which is a common therapeutic drug, which can cause hair loss, and it seemed to reduce that. And some of the dosing here is just like 1,000 milligrams of these essential fatty acids a day. And in my clinic, I do at least 2 grams of essential fatty acids most of the day. And that's foundational for me. Foundational treatment for me is just like, hey, why not get on a good high potency multivitamin? Why not just take fish oil? Boom, baseline, that's it. I mean, almost every podcast we talk about, it seems to have some benefit. It's certainly not going to hurt you.
Right.
Another interesting one is solubilized keratin. We know that any type of protein deficiency will cause hair loss. Keratin is the main protein, or the main protein component of hair. You can take it in supplemental form, solubilized keratin. It's called cynidine. And you can find it in supplement form. This is something you can just Google. Some compelling research on that. Also, we also know that keratin is a rich source of cysteine. That's part of what makes up N-acetylcysteine. So, taking this cynidine in a conjunction with N-acetylcysteine can also help reduce hair loss and give the hair a better appearance and make it look thicker. Silicon. This is just a trace element that's present in the bodies. It's thought to function as a structural component of hair. Studies have looked at it. Another form of orthosilicylic acid. which it just provides the silicone. In one study, 50 women were given 10 milligrams of this orthosalicylic acid or placebo. By the end, the hair brittleness decreased with the women receiving the silicone supplement. Seemed to help with hair thickness. I think there's a water out there that is high in silicon. It's an over-the-counter water. I forget. It's I could be wrong, but Meiji water. This is one of the things that people, when they advertise it, they tout the amount of silicon in it and how good it is for you. There are a number of herbs that also have silicone in it too, like equisetum, which is horsetail, and then also stinging nettles. Stinging nettles grows everywhere, and you can eat those. But a lot of people, you'll see this in hair and nail formulas and supplements where you'll see these two herbs in there a bit because of the silicone nature of the content in there. We talked about zinc. I won't really go into the studies, but there's some neat studies on zinc that really help. Most people are subclinically deficient in zinc. Lower zinc levels have been correlated. Again, we don't say correlation means causation, but it has been correlated with increased severity. So lower zinc levels, increased baldness, longer duration, increased likelihood of, if you're treating hair loss and you have low zinc levels, you may not get the benefits that you need. And that goes for natural treatments and, pharmaceutical treatments or any surgical stuff. Like, you just want to make sure that your mineral status is on board. And it was like Joe Rogan was talking about, when you do the hair transplants, taking it from a place where you have growth to a place where, it's basically, toxic, if you will, on your scalp. Well, you have to add fertilizer to your scalp to get things to grow. And having these minerals there can really help. Yeah. Another thing that will add to the fertilizer, what are called tocotrienols. These are just members of the vitamin E family. They're found naturally in grains and nuts. And there's many different forms of them. There's like alpha, beta, gamma, delta, just like in vitamin E. The multivitamin I gives you all 4 forms of vitamin E instead of just one form. But they're anti-inflammatory. They're actually radioprotective. So radiation, sunburns, anything like that could damage the scalp, it will certainly help. There's lots of evidence emerging that it just promotes healthy hair growth. Let's see here. Green tea. This is pretty interesting to me. And this was topical solutions of a component of green tea called EGCG, where they are actually putting this topically on animals in rat studies. I think it was primarily where the polyphenol was rubbed in and just helped prevent hair loss and aided growth. And they did another animal study where they actually get these rats green tea solution, added to their drinking water versus just plain water. And the ones that had the EGCG or the green tea in it seemed to have better hair growth and regrowth. Selenium, another thing that's found in a multivitamin, also very high in Brazil nuts. Very important for hair follicle function. Selenium deficiency is another thing that is more prevalent than we think. And I want to say subclinical deficiency. Let's see, let me see if I can find a study. Oh, okay. An 8-week randomized controlled trial in 64 women with PCOS. 32 received 200 micrograms of supplemental selenium daily, while the other half just received nothing or placebo. And the selenium group had significant reduction in hair loss compared to the placebo group. So it's it raises your eyebrows, so to speak. Certainly not going to hurt to be on a multivitamin. Most multivitamins actually, I think, if it's pretty good, have like either 100 micrograms to 200 micrograms in there. You can actually get 200 micrograms of selenium just eating 4 Brazil nuts a day. Another interesting thing is topical melatonin. So instead of taking it orally, you can use it as a topical treatment for hair loss.
It's been a long day.
Yeah. While you're in the tropics, which can reduce stress and also help with aid in preventing hair loss. I think they're using like a 0.1% topical melatonin solution in a lot of these studies. And what they're just finding is that, the topical melatonin group just has more hair in the growth phase than in the others. Number of studies that they've done on women in both like the male pattern hair loss and even in, I think, the autoimmune alopecia hair loss. These things are easy. These are things that you can find over the counter or can try before you even talk to your doctor about it.
Yeah, exactly.
And then we talked about iron. And this is common in women because iron is one of those things where, a premenopausal woman who's having a menstrual cycle can be very prone to anemia and not even know it. And it can affect hair also. And also can be, if they're iron deficient, it certainly can affect hair growth. And that just takes supplementing iron. We know that hair loss, especially premenopausal women, is there when you have low ferritin levels, the storage form of iron in your blood. Any type of anemia, iron deficiency anemia, should be supplemented with iron and certainly can help. So all those things that I just mentioned, Brian, those are things that I will use. But I have to say, like, one of my favorite things to use for this I always go back to the Chinese herbs because they work, they just seem to work so well and over time. And one of these that I use is called 7 Treasures for Hair. So as the name implies, it's a herbal formula that it's called Qibao Mei Run Wan, and it literally translates into 7 treasures for beautiful hair pills in Chinese. And basically what it does is, in Chinese medicine, which goes back to like kind of the iron stuff, any type of blood deficiency, which is not exactly the same thing as anemia in Western medicine, but it can show up, and that could be a Chinese diagnosis if you do have iron deficiency anemia or any type of anemia. Would be part of your diagnosis in Chinese medicine, be called blood deficiency. Well, a lot of these formulas just help tonify blood, so to speak, and that's what these herbs do. And this formula is great for that. Another formula that I will use, or a specific herb that's used a lot in Chinese medicine, is called Hishu Wu, or Fo Ti. And this herb is polygonum, and it's full of resveratrol for one thing, but it actually is great for hair loss and graying hair too. They even use it in that too. And they're very safe herbal formulas. For the most part. I mean, you want to, some of these formulas you want to take for a while and then take a break and then get back on it again. And they all treat like kind of these blood deficiency things that we were talking about. What else here?
Are you using acupuncture on this, Keoni?
Absolutely. I was just going to bring that up. And so you can use acupuncture, and you can use scalp acupuncture. And basically what you're doing is you're bringing qi or blood to the scalp. But from a Western perspective, by doing scalp acupuncture, you're creating microinflammation into the scalp, right? Mm-hmm. Which will cause the body to increase blood flow to the scalp, which can help with hair growth. I don't know of any studies that have shown that, but you'll see a lot of anecdotal stuff on acupuncture for the scalp. I'm sure there's plenty of Chinese studies on this, which I'm just not aware of, but it is something that is considered a treatment for hair growth. Anything that stimulates blood flow to the scalp, even gentle scalp massages can help. I mean, hell, hanging upside down on an inversion table, in theory, at least can help. I don't know of any studies on that, but anytime you increase blood flow to the scalp, you can certainly help. There's something called a 7-star technique or 7-needle technique, where you take it's like a little hammer that has little needles on it, and it's on like a little flexible lever that you just kind of go all over the scalp with, and it basically stimulates blood flow, which can certainly help there also. And then another thing that I'm surprised it's up sooner is topical caffeine, which kind of does the same thing. There's actually lotions and creams out there that you can get online whereas caffeine seems to also help bring blood flow to the scalp. And it just led to better growth and less loss of hair. And, these are things that you can, I think there's even some shampoos that even have like caffeine in them. And combining some of these topicals with a good multi and some of these more specific things certainly can help. So I hope that helps, Brian. I don't want to see you bald in like 10 years from now. All right. So now you know.
I don't want that either. It seems like nuts, really important thing to add to your diet. Obviously, like we've been mentioning, kind of having that tier of multivitamins. They have the
tocotrienols in there, and they have lots of minerals in there, like the zinc, selenium, and that type of thing. Certainly can help. I mean, a healthy diet, any diet that keeps your blood sugar levels stable is going to keep you out of this.
Yeah.
There is a correlation between, with people with cardiovascular disease. We see that people with male pattern baldness, that especially early on, are more prone to cardiogenic type diseases.
Mm-hmm. Mm-hmm. And we definitely see it with like CHF, even just on the lower extremity, like the hair really not existing once we get those cardiovascular changes, things like that.
Anything that will cause any occlusion, smoking, lack of exercise, lack of movement can certainly, cause some hair loss in other areas of the body. That's for sure.
Yeah, and definitely being nice to your hair physically. I know that's one of my biggest problems, Keoni. When I get real stressed out, I know I have all these memories of college of taking like an organic chemistry test, and I just constantly, it's how Haley tells me she can tell when I'm stressed out because I'm just fumbling through my hair and just like really brushing through it as I'm trying to figure something out. And I'll hand in my test, and it looks like Chewbacca practically. There's like 20 hair follicles all over my paper from doing that.
And in extreme cases, it's trichotillomania, right? Where you actually are pulling it out, and you're doing it, but you can't stop.
Right.
And I've had a number of patients over the years who would do that. And, one of those things that can certainly help is NAC as far as natural treatments go to help with that type of hair loss. So anyway, guys, I hope that helped everybody out there. Let us know if you have any questions, please. If you're getting some help or you find these podcasts useful, please pass it on to your friends and stuff. Give us a listen.
Not even just your friends. Just tell everyone you see on the street. Just boom, 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 boom as you're walking down the street.
Yeah, shout it out, right?
Go to the rooftops, scream it, spray paint it around.
Right.
Yes. Anything else, Keoni? I think we got a good hierarchy of stuff, and someone, it reaches everyone. Someone like me, I can address it hopefully before I get to that point, and maybe for someone like Jade as well.
Yeah. Well, hey, we should get Jade to listen to this, maybe, and if he can grow his hair back, then we have definitely done our job.
We will definitely get a lot more listeners. If he comes back with a long mane, we'll be gold.
That's right.
All righty, everybody. Until next week. We appreciate you listening, and we will talk with you next week.
Take care, everybody.